Hello, my name is Adekre, and today I'm performing my head, face, and neck lab exam. And today is the 28th of October. And today I'm going to allow my patient to stay seated. I'm going to first start with inspecting the entire circumference of the skull, and then I'm going to also start to palpate. I'm going to ask my patient if they're feeling any tenderness or if they're experiencing any pain, and just to let me know if they are feeling any tenderness or discomfort during the scalp palpation. I'm then going to palpate the hair texture and thickness to see if any thinness or any dullness or dryness. And then I'm going to palpate the temporal arteries here. And then after that, I will also take the temporal arteries with the bell of my stethoscope. So here, here. Once I've completed that, I'm going to then go ahead and inspect the face. So I'm going to see the face in front on, and then I'm going to ask my patient to do certain facial expressions so I can observe them. So the first one is just a smile, and then I'm going to ask my patient to raise their eyebrows, and then I want to see them close their eyes, and I'm going to try to lift up their eyes, and they're going to try to resist it. And then the last thing I want to do is that they can want them to puff out their cheeks, and I'm going to basically press into them lightly. Then after that, I'm going to observe the TMJ. So with the TMJ, I'll stand in front of them as well, and I'm going to ask my patient to open and close their mouth, and then I'm going to ask the patient to protrude their lower jaw, like so. Basically, that it's going to be placed in front of the upper teeth, and with that, it's gonna basically I'm going to ask them to go side to side, doing so. And then once they finish that side-to-side movement with the protruded jaw, I'm going to ask them to insert the second, third, and fourth digits between their incisors. So they'll put it in their mouth themselves, their digits in their mouth themselves, and then I'm going to move on to palpation of the TMJ. So once again, I'm going to be standing in front of the patient. I'm going to have the patient open and close their mouth. And then I'm going to palpate the masseter and the temporalis muscle. So I'm going to ask the patient to clench their teeth as I palpate for the contraction. So once I get into temporalis, I'll palpate here with the teeth clench, and then the masseter, I'm going to also palpate as well too with their teeth clench. Then I'm going to be testing for sensation of the face. So I'm going to use a cotton. I'm going to ask them if they can feel this, and then I'm going to palpate at different areas on the face. So while I'm doing this, I'll ask them if right here, if it's the same, they feel it, it's the same intensity throughout, and then also if they can feel it on both sides, side to side. As I'm doing this is bilaterally on one side to the side. Can you feel it on this side? Can you feel it side to side? Is it the same intensity throughout? As I keep on going, I'll be repeating these questions all throughout. Then I'm going to palpate for the frontal and maxillary sinuses. So in order to do this, I'm going to use my thumbs to press superiorly on the frontal sinuses, and this is usually going to be at the bony brows. So pretend that these are the brows. I'm going to use both of my two thumbs. I'm going to palpate here. And then I'm going to palpate for the maxillary sinuses, and palpate here as well too. And then after I finish palpating, I'm going to then percuss those two areas. So I'm going to do that. And then percuss the maxillary sinuses as well. All right, and once I'm finished that, I'm then going to move on to my neck area. So I'm going to inspect the neck visibly, walk around the patient anteriorly and posteriorly to properly inspect the neck. I'm going to look for range of motion. So basically, I'm going to ask my patient if they can flex forward, extend their neck backwards, extend it to the right, extend it to the left. I'm also going to ask them to keep it down onto the right and then down onto the left as well. After I can see that the range of motion is okay, I'm going to expect them to do if they experience any cervical tenderness. So on palpation, I will palpate the exterior neck, which will be a little bit strange. So basically, this is the neck. I'll be palpating the neck up, make my way up the paraspinal muscles, like motion palpation, but it would just be going all the way up. A little bit hard to see through this, but it'll be going all the way up. And then after I finish that, I'm then going to test for the spinal accessory nerve, and I will basically be doing that with my patient seated, and it's a resisted head extension, so contralateral. So I'll ask them to shrink on the right side. They can bring their shoulder up, and then they can also extend and come down, and I'm also just going to try to make sure that there's some resistance between it and it's not touching. Same thing for the opposite side. You can bring the shoulder up, the head will come down, and I'll make sure there's some resistance between that as well too. And then I will secondly section up the mastoid. So my hand will be on the back, and then the front, and resistance here, and once again, some resistance here. Then I'm going to move on to palpation of the 10 cervical lymph nodes in the neck. So I'm going to first start off with using the pads of the 2nd, 3rd, and 4th digits of my fingers, and I'm going to apply pressure in gently in a circular motion. I'm going to first start off with the pre-auricular, so put it on the side, with the pre-auricular, that's to the front, then the post-auricular, then I'm going to do the occipital. The occipital will be back here, and then the tonsillar, submandible, submental, the front, and then the superficial cervical, which will be basically starting at the clavicle, making its way to the traps, and really going in, working it into the traps and into the SCM. And then we will do the posterior cervical, which is basically starting at the trachea, then to the jaw, and then to the SCM. Afterwards, we're then going to be palpating the supraclavicular. So I'm going to ask the patient to pretty much have the patient roll their shoulders forward, and then I'm going to be palpating for the supraclavicular down here. And one last thing that I did not do was the deep cervical chain, which would be, once doing the deep cervical chain, I'm going to have my patient head forward, so their head's going to face forward, and then I'm going to be going underneath this SCM, underneath format. Then I'm going to perform the tracheal deviation, so I'm going to ask my patient to face their forward to the left, place a finger, face their forward to the right, place a finger, and then right in the medial, almost to the trachea, is where I'm going to ask them to place their finger down, facing forward for this next 3rd finger. Once I've completed that, I'm going to then palpate the thyroid gland. So first I'm going to inspect the neck for the thyroid gland, and in order to do that, I'm going to stay in front of the patient as I am. This patient's going to slightly extend their neck, and then I'm going to use tangential lighting to basically watch as the patient swallows. And basically, wherever there's that upward movement, that's the setting of the thyroid gland, and that's where I will palpate in that area. Basically where the swallowing settles, once again, that's where I'm going to be palpating that area. Afterwards, I'm going to be palpating from behind. So basically, the same applies, but I'll be using my 2 fingers. So I'm going to ask my patient to slightly flex their neck forward, and then I place the pads on my fingers from both onto the neck. So the index fingers is what I'm really going to be using, and it's just going to be just below the cricoid ligament. And then I'm going to ask my patient to swallow once again, and then I'm going to feel for the isthmus rise under my fingers, and that's where I'm going to be palpating. And then I'm going to displace the trachea. So I'm going to start with the right hand side, and then I'm going to palpate here, holding that in, and then on the left. So it's bilaterally done. So I'm palpating the lateral lobes, basically. After that, I'm going to then do my auscultation of the thyroid for roots. So basically, I'm going to place the stethoscopes, and this is going to be on the person's direct skin. And I'm going to place the stethoscope at the trachea at the level of the 2nd and the 4th tracheal rings. So my stethoscope is going to be placed exactly right onto it. I'm going to auscultate for about 10 to 15 seconds here. I'm asking the patient to hold their breath during the auscultation. And then I'm going to be auscultating for the carotid arteries. And basically, I'm going to place the stethoscope over the carotid bifurcation bilaterally. And this is basically going to be located near the end of the thyroid cartilage, but below the jaw or the mandible, and lateral to the, pretty much lateral to the trachea. But I'm just going to place it there for 10 to 15 seconds. Also, my patient's going to be holding their breath while I'm doing this as well too for 10 to 15 seconds. And that would be that.